Before going in, just some information on our speaker. Danna Raphael is a registered dietitian who comes to hospital for special surgery with over 10 years of medical nutrition therapy experience. She's worked with a diverse patient population in a variety of settings, including oncology, critical care, and liver transplant, as well as in general nutrition care. Currently, Danna is an inpatient dietitian as well as the dietitian on HSS's ALS clinic team. And her presentation today will be on nutrition and lupus, and will cover key nutrients to maintain weight, anti-inflammatory foods, medications' effect on food intake, and other topics. Go ahead, Danna.
Thank you so much for having me today. And again, I do apologize that technology is not on my side today. So as Christine was saying today, I will be reviewing just general nutrition, some anti-inflammatory foods, vitamins and minerals, foods to limit and avoid, how to optimize your nutrition, medications and side effects, nutrition and co-occurring conditions, as well as some recipe modification tips. Lupus is an autoimmune disease that can affect many body systems. The foods that you eat, along with the medications you take, may have an effect on some of your symptoms. It's important to understand that there is a link between lupus and osteoporosis, heart disease, and kidney disease. So maintaining a healthy diet can have a positive impact with these co-occurring diseases. A well-balanced diet with proper nutrition can positively benefit those living with lupus by reducing inflammation, prevent nutrient deficiencies, maintain strong bones and muscles, combat side effects of medications, achieve or maintain a desirable weight, and reduce the risk of heart disease. So general healthy nutrition recommendations are to have a well-balanced diet that has a focus on fruits and vegetables, whole grains, lean proteins, and healthy fats. Fruits and vegetables are chock full of vitamins and minerals that are essential to helping the body function its best. You know, they don't say eat the rainbow for nothing. Consuming a wide variety with different colors can help you obtain different nutrients. Fresh, frozen, or canned are all good options. The recommendation is to eat a fruit, vegetable, or both at each meal, and a serving size is typically about a half a cup cooked or 1 cup raw. Whole grains are a low-fat source of energy and provide a good amount of fiber, and some examples of whole grains are whole wheat bread, brown and wild rice, quinoa, oats, and farro, and a serving size for these are about like 1 slice of bread or a half a cup of cooked grains. As far as proteins go, choosing lean proteins such as eggs, skinless poultry, lean ground chicken, turkey, fish, lean meats like 90-10 ground beef, veal, lamb, and the beef and pork tenderloin cuts are typically leaner. And the preferred cooking preparations include broiling, baking, roasting, poaching, or grilling are better over frying. The recommendation of protein really depends on a variety of factors such as activity level and weight. Beans, nuts, and seeds are a good source of plant-based proteins as well as high in fiber. And choosing unsalted nuts and seeds and their butters like peanut butter, almond butter. I mean, they have a variety now: cashew, walnut, pumpkin seed, sunflower seed. I think really anything can be made into a butter. So those are good sources of the protein, as well as dried beans and legumes, or if you're using canned, choosing the low sodium option and making sure to drain and rinse them before eating. Soy products like tofu, tempeh, and edamame are also great sources of plant-based protein. Just a note, if you are consuming a more plant-based protein, make sure to consume some kind of vitamin C, like citrus or berries, to increase the absorption of iron. Next, I want to highlight the importance of fat in the diet. Fat supply calories help you absorb certain vitamins and provide essential nutrients that your body needs to function. Monounsaturated and polyunsaturated fats are considered the healthy fats. So monounsaturated fats are found in things like olive oil, peanut and canola oils. The highest concentration of nuts, they're found in almonds, hazelnuts, and pecans, and in seeds like pumpkin and sesame seeds. Substituting these oils in place of butter and other saturated fats like lard, palm oil, coconut oil have been shown to improve heart health by reducing cholesterol levels. There are two major classes of polyunsaturated fats, and they are omega-3s and omega-6 fatty acids. These are considered essential, meaning your body cannot make them and you must consume them from food. A diet rich in polyunsaturated fats have been shown to have a positive response in patients with lupus by lessening inflammation in people with autoimmune diseases. There are some studies that have also shown that the intake of omega-3s have reduced lupus flares and lessened fatigue. And while your body needs both omega-3 and omega-6 fatty acids, omega-3 fatty acids are considered anti-inflammatory, while omega-6 fatty acids are pro-inflammatory. So consuming too many omega-6 in relation to the omega-3s is thought to promote inflammation. You can see the polyunsaturated fats are vegetable oils like safflower, soybean, sunflower, and corn oils, which you typically see in fried foods and packaged foods. The typical American diet tends to contain 14 to 25 times more omega-6 fatty acids than omega-3s. And so the recommendation is to limit the intake of fried and processed foods, which again typically contain those oils that are highest in omega-3s. Now, am I saying to never eat fries or chicken fingers or potato chips? No, but just to limit and try and eat more of the foods that contain omega-3 fatty acids. So some of the good food sources of omega-3s include avocados, flaxseed, chia seeds, hemp hearts, nuts like walnuts and pecans, and the oils like canola, walnut oil, and flaxseed oil. Fatty fish that are highest in omega-3s but low in mercury are salmon, mackerel, anchovies, sardines, and herring. There are many anti-inflammatory foods that you can incorporate into your diet, but I'd like to highlight the following. Berries are packed with fiber, vitamins, and minerals. They also provide antioxidants that may reduce inflammation, boost immunity, and reduce the risk of heart disease. Fatty fish like salmon, mackerel, anchovies, and sardines are great sources of protein and contain the omega-3 fatty acids, which, as we just discussed, can reduce inflammation. Broccoli and other cruciferous vegetables can decrease the risk of heart disease and certain cancers. Avocados are high in heart-healthy fats and contain antioxidants. Green tea has an antioxidant and anti-inflammatory property that reduces the risk of heart disease, obesity, cancer, and Alzheimer's. And turmeric contains anti-inflammatory compounds called curcumin. And a little tip with eating either fresh or powdered turmeric, to increase the absorption, make sure to eat it with some black pepper. Extra virgin olive oil is a healthy fat that has been shown to have anti-inflammatory benefits, as well as dark chocolate and cocoa also contains antioxidants that reduce inflammation. So note that most of these are fruits, vegetables, lean proteins, and healthy fats. So following a general healthy diet or something comparable to a Mediterranean diet that is rich in these foods will help reduce inflammation. I'm going to review some specific vitamins and minerals and how they relate to lupus. Vitamin A has potent immunomodulatory effects. Vitamin A treatment in combination with some immunosuppressive drugs have shown to have a beneficial effect on lupus nephritis, which is like the kidney disease that's associated with lupus. A deeper understanding of its actions is needed before a clinical recommendation can be made, either recommending to take a vitamin A supplement. It's hypothesized that the effects of vitamin A on lupus are disease stage specific, so aim to get them from food sources versus supplements. So foods that are high in vitamin A, the orange foods you typically think of: carrots, pumpkins, sweet potatoes, squash, cantaloupe, broccoli, liver, and fish also contain vitamin A. Vitamin E has been shown to reduce markers of inflammation, stabilize immune cells, and prevent autoimmune attacks, and reduce the levels of autoantibodies in lupus patients. There is no study on the actual mechanism of vitamin E in lupus and lupus therapy. Future studies are required to fully investigate the association between vitamin E and lupus, but the recommendation is to focus on food sources and talk to your doctor about supplementation. Vitamin E is found in nuts and seeds, wheat germ, avocados, mangoes, asparagus, and pumpkin. Vitamin D is best known for its benefits in bone health, but there is a lot of evidence in the role of vitamin D in non-skeletal diseases, such as autoimmune diseases and regulating the immune system. There's a statistically significant association between vitamin D levels and high lupus activity. Vitamin D inadequacy is highly prevalent in lupus patients due to the avoidance of sunshine, sunscreen use, kidney insufficiency, and medication such as glucocorticoids. Sources of vitamin D are from the sun, food, and supplements. However, vitamin D is found in very few foods. Sources include fatty fish like wild-caught mackerel, salmon, tuna, egg yolks, beef liver, and mushrooms that have been exposed to sunlight or UV light. Vitamin D is added to milk and other dairy products, orange juice, and cereal. It is difficult to get all the vitamin D you need through food alone, and most people do need to take a vitamin D supplement. Vitamin D supplementation is safe and widely available, and besides its potential benefit to improve lupus activity, vitamin D is also helpful for bone health and cardiovascular manifestations of lupus. So talk to your doctor about getting your vitamin D level assessed, and based on your blood levels, a recommendation on how much you need to take will be made. As with a lot of these things, more research is needed to better understand the role of vitamin D to determine the ideal range, the range of your serum vitamin D levels for musculoskeletal, cardiovascular, and immune health. And since vitamin D has an immune modulating effect, it is possible that vitamin D deficiency is not only a risk factor, but also a consequence of lupus. But again, more research is needed. I think we just reviewed this page, but just so you can visualize the food sources of vitamin D, they're up here. Calcium plays a major role in bone health. Chronic inflammation associated with lupus and the medications used to treat the disease, particularly prednisone and other steroids, all contribute to the risk of osteoporosis, which is a skeletal disorder caused by the loss of bone mineral. You can get enough calcium through food and add in a supplement if needed. Calcium-rich food sources include dairy, like low-fat milk, yogurt, and cheese, dark leafy green vegetables, broccoli, kale, collard greens, Swiss chard, bok choy, seafood like sardines, and canned salmon with the bones. And it's also fortified in fruit juice and soy products, as well as pasta, bread, cereal, and other grains. The recommendation is to get between 1,000 and 1,200 milligrams of calcium daily, and calcium is best absorbed when taken in amounts of 500 to 600 milligrams at one time, and preferably with a meal. You'll see with calcium supplements, the recommendation is usually 2 pills. You take one in the morning and one at night, so for best absorption. Antioxidants like vitamin C and selenium can help protect against free radicals. Those are molecules that can damage your cells in a process called oxidation. Studies show that people with lupus might have higher levels of oxidative stress And there's not much research on the benefits of antioxidant supplements for people with autoimmune conditions, and it's best to get antioxidants from foods, including fruits and vegetables and whole grains. So from vitamin C, all citrus fruits, dark leafy greens, broccoli, peppers, strawberries, Brussels sprouts are just some of the high vitamin C foods. Selenium, moving on, selenium might have a protective effect, reducing lupus symptoms. Supplementing the diet with additional selenium seems to have an anti-inflammatory effect. Overall, it's best to get selenium through the diet. And surprisingly, Brazil nuts are a very rich source of selenium. With just 2 Brazil nuts a day, you'll get the recommended amount of selenium. Like if you've ever noticed in mixed nuts, you typically only find like 3 or 4 Brazil nuts, because if you consume too many, you can take in too much selenium. Other food sources of selenium include seafood, eggs, brown rice, and meat. So some herbal supplements are thought to have immune stimulating properties, which might trigger a lupus flare. But they can also work against immunosuppressant medications and may increase immune system function. And these include echinacea, spirulina, alfalfa, and garlic. So definitely talk to your doctor before taking any kind of dietary supplements. So some foods to limit: salt, sugar, and alcohol. A high salt diet is considered an important contributor to heart and kidney disease, and a diet high in sugar can contribute to heart disease and diabetes, which people with lupus are at higher risk for developing. So try these tips to reduce the salt and sugar in your diet. You're cooking more meals at home. You can control the added salt and sugar. When you're looking at packaged foods and restaurant meals, they're often higher in salt and sugars. Check the nutrition fact labels and on the packaged foods and choose ones with less salt and sugar. Try flavoring your food with herbs and spices instead of salt and sugar. Drink water instead of sugary soda. Try adding herbs or fresh fruit to sparkling water for extra flavor. And if you do drink alcohol, it's important to drink only in moderation. Also, alcohol can interact with some lupus medications, so ask your doctor if you need to avoid alcohol with your medicine. And just a note on nightshades, there is anecdotal evidence that nightshade vegetables, those include white potatoes, tomatoes, peppers, and eggplant, can be related to inflammation, but there is no solid scientific evidence to support this concept. And foods that seem to trigger a flare vary from person to person. So a food that causes problems for one person may have no effect on another. So lupus can sometimes cause weight loss or weight gain. Weight loss may be unintentional and due to decreased appetite or problems with the digestive system. Digestive symptoms can occur if lupus-related inflammation affects the pancreas, the lining of the abdomen, or large intestine. These can include severe abdominal pain, nausea, and vomiting, and it can also be a side effect of some of the medications used to treat lupus, including glucocorticoids and non-steroidal anti-inflammatory drugs, also known as NSAIDs. So consuming smaller, more frequent meals and eating your larger meal, whatever time of day you feel best, can help. If you're eating small, frequent meals, some tips and tricks to increase your protein include blending nuts and seeds or tofu into smoothies. I know what you're thinking, tofu, but it really doesn't have a flavor and really easily blends into anything and takes on the flavor of what you're mixing it into. And there's about 10 grams of protein per serving. So keep that in mind. Adding nut and seed butters can also be stirred into yogurt or hot cereals. Pureeing beans and lentils or soy products and add those to the soups and stews or sauces. Hummus adds calories and protein. Yogurt, especially Greek yogurt, can be added to hot cereals, smoothies, soups, sauces, and used in dips to increase the protein content. In some ways to increase the calories, adding healthy fats such as nut and seeds or avocados into shakes. They can be blended into sauces or soups to increase the nutrient density, using plain Greek yogurt, avocado, tahini, which is sesame seed paste, or hummus in place of mayonnaise for tuna salad, egg salad, or chicken salad will increase the calories. And to help manage weight loss, it may be recommended to incorporate a high-calorie, high-protein oral nutrition supplement, such as Boost or Ensure, using a fortifier like Carnation Instant Breakfast into smoothies, or Benecalorie. I'm not sure if you guys are too familiar with that. It's a 1 ounce shot, basically, that can be added to really anything, and it's a very high-calorie, high-protein. So anti-inflammatory medications like aspirin and NSAIDs, can interact with prescribed blood thinners. I guess certain foods can interact with prescribed blood thinners. Certain vitamins like vitamin K. Vitamin K foods are leafy greens, green tea, cranberry juice, and also fish oils can also affect the blood thinners. So omega-3 supplements may extend the time it takes for bleeding to stop. So if you're taking any anti-inflammatory, it's recommended to talk to your doctor about the supplements you take. And you also may have to watch your intake of vitamin K foods. Methotrexate can cause sun sensitivity and liver damage. Avoiding alcohol and NSAIDs are recommended. Adding a folic acid supplement to your diet may be helpful. And some food sources of folic acid are dark leafy greens, beans, whole grains, peanuts, and sunflower seeds. So moving, highlighting some more medications. Glucocorticoids are medications that act as powerful anti-inflammatory and immunosuppressive agents, and they can also increase the risk of developing other conditions such as type 2 diabetes, high blood pressure, heart disease, and obesity. So some nutrients to be mindful of: calcium and vitamin D. Corticosteroids can cause or worsen osteoporosis, so consuming adequate calcium daily is important for bone health, and vitamin D helps the body absorb the calcium. Corticosteroids can elevate your blood pressure, so limiting sodium may be important. If you are experiencing fluid retention that causes swelling, you should lower the amount of salt and sodium-containing foods you eat. In particular, processed foods should be avoided. Corticosteroids can also elevate your cholesterol and lipids, so watching the intake of processed, fried foods, fatty meats can help decrease the risk of heart-related issues. And lastly, corticosteroids can also increase the blood sugars. So to help keep blood sugar stable, it's important to limit the intake of concentrated sweets, like large quantities of desserts, juice, regular soda, and other sugar-sweetened beverages. In discussing how steroids can affect your body, I wanted to highlight some of the conditions people with lupus are at risk for and how to optimize your nutrition regarding some of these co-occurring diseases. First up, osteoporosis. So the definition is a silent skeletal disorder caused by the loss of bone mineral content. It is marked by low bone mass and density, microscopic deterioration within the bone, and decreasing bone strength, leading to bone fragility and an increased risk of fracture. Osteoporosis occurs when your body makes too little bone, loses too much bone, or when there's a combination of both. Inflammation caused by lupus affects many body tissues, including the bones, and inflammation contributes to the loss of bone mineralization. There's been studies of women with lupus, and they've found that they have an increase in bone loss that leads to osteoporosis. So what other causes of bone loss in people with lupus, aside from inflammation? Other factors include the use of corticosteroids or glucocorticoids. These drugs are often used to treat lupus that can also lead to bone loss. because they decrease the body's ability to absorb calcium and they break down other minerals in the bones. Kidney disease, which affects about 30% of people with lupus, and the diminished ability or desire to engage in physical activity because of severe lupus symptoms. Physical activity does increase bone strength. Being postmenopausal, going through early menopause, or having no menstrual periods, estrogen is a bone protective hormone. A family history of osteoporosis, insufficient intake of calcium and vitamin D, low sun exposure, tobacco or nicotine use, and excess alcohol intake can all contribute to bone loss. The good news is that we can do things to make our bones stronger. For people with lupus, the emphasis is on controlling inflammation and preventing organ damage. There are additional approaches to reduce the risk of developing osteoporosis, and these include exercise, particularly weight-bearing exercises, to build muscle strength, following good nutrition and supplementing with vitamins and minerals if needed, reducing your caffeine intake, avoiding smoking, moderate alcohol consumption, no more than 2 or 3 drinks a day, and making medication changes, talking to your provider with trying to avoid long-term use of prednisone and other steroids when possible. A bone-preserving treatment goal would be to take the lowest dose of steroids for the shortest amount of time, if possible, to control the disease activity. And the use of immunosuppressive drug therapy to taper the steroids, if medically feasible, to control disease activity can help to preserve bone. Some important issues to consider with lupus are corticosteroids like prednisone can lead to hardening of the arteries, known as atherosclerosis. Atherosclerosis is a common cause of heart disease in people with lupus, and kidney disease in association with lupus can also affect the heart. Women with lupus have a higher risk of heart disease than the general population, with risk factors like high blood pressure, high triglycerides, and high cholesterol. And although you're unable to change your risk factor like genetics, gender, and age, there's still a lot that can be done to lessen your risk. So some general guidelines for a healthy heart are to limit saturated fat, so watching your intake of butter, lard, and shortening, as well as fat in meats, poultry, whole milk. It's also found in some plant sources like palm oil and coconut oil, choosing monounsaturated and polyunsaturated fats, which benefit the heart. As previously mentioned, olive oil, canola oil, sunflower oil, as well as avocados, nuts, and seeds, and their butters are some of the mono and polyunsaturated fats. Limiting your sodium intake to about 2,000 milligrams a day. Sodium is naturally found in foods in small amounts, but salt is often added to processed foods, such as frozen meals, canned soups, vegetables, sauces, pudding mixes, breads, and cereals. So when buying these types of foods, try and compare the content of salt on the food labels, using herbs and spices to enhance flavor rather than salt, consuming alcohol in moderation, avoiding exposure to tobacco, maintain a normal blood sugar level, maintaining a healthy weight, and trying to exercise, about 30 minutes a day will all help your heart. Specific recommended diets would be the Mediterranean diet or DASH diet. The Mediterranean diet focuses on fruits, vegetables, whole grains, legumes, fish, and olive oil. This diet is high in fiber, antioxidants, and low in red meat and high-fat dairy. The DASH diet stands for Dietary Approaches to Stop Hypertension. It's low in sodium, saturated fat, and cholesterol. It's high in fiber, and it focuses on fruits, vegetables, calcium-rich foods, versus a typical Western diet, which is high intake of red meat, dairy, butter, fats and processed foods, salt, and sugar. In people with lupus, the immune system mistakes its own tissue as a foreign substance, setting off a response that leads to tissue inflammation. In a person with lupus, inflammation can become chronic, resulting in damage to joints or organs. And when this happens in the kidneys, it's known as lupus nephritis. Learning what to eat when you have lupus nephritis may seem overwhelming at first, but with the support of a dietitian or another expert who specializes in kidney health can help. Some general guidelines are to choose heart-healthy fats over saturated ones. In particular, the omega-3 fatty acids are beneficial. They promote a healthy immune function. Researchers have found that flaxseed offers protective effects against lupus nephritis. Flax seeds, either whole or ground, can be added to oatmeal, granola, yogurt, baked goods, and smoothies. Many fruits and vegetables contain potassium, and unfortunately, if your kidneys aren't functioning at full capacity, too much potassium can be dangerous. So choosing lower potassium options will give you the vitamins and minerals and antioxidants while protecting your kidneys. These are just some examples of the low potassium fruits and vegetables. Another tip is spacing your intake of these foods throughout the day to give your kidneys more time to process the potassium foods, so your blood levels are less likely to spike suddenly. It's important to also keep in mind that whole grains and beans also contain potassium, so tracking your potassium intake from multiple sources might be needed. Another nutrient to be aware of in kidney disease is sodium. It can cause high blood pressure and strain the kidneys. So watching the salt intake is one of the most important diet changes to protect kidney function. So some ways to cut back on sodium are avoiding pickled foods like pickles, olives, preserved foods like cold cuts, hot dogs, sausage, bacon, canned items. Reading the food labels when purchasing condiments, frozen meals, or snack foods to compare the sodium content in different brands and then choosing the lowest one. Rinsing canned foods with water will help cut down on the sodium content. Look for sodium-free canned goods like beans or soups. Frozen vegetables are sodium-free alternatives from some of the canned ones. And when you're dining out, restaurant meals and takeout food usually have more salt than you'd add when cooking for yourself. So check the menus ahead of time to see if there's any low sodium options, or ask your server if your food can be prepared with minimal salt. And then again, with the potassium, you want to avoid some of these higher potassium containing fruits and vegetables. And, there has to be a balance. So, you can have a little bit of these foods, like a half a banana, or maybe a small clementine, or a little bit of tomatoes. It's not like you have to completely avoid these foods. And just another note on nutrition and kidney disease, depending on your kidney function, sometimes it's recommended to watch your intake of protein, but that's definitely person specific. So a few ways to modify recipes and cooking. Standard pantry ingredients contain salt that you may not know about unless you look at the label. So look for the no added salt versions of things like canned tomatoes, broths and stocks, and canned beans and other vegetables. Choose the reduced sodium product. Let's use soy sauce for an example. 1 tablespoon of regular soy sauce contains about 1,000 milligrams of sodium versus the low sodium that has around 600. You don't really taste much of a difference. Again, draining and rinsing your beans, canned vegetables can cut the sodium by up to 25%. And frozen vegetables are just as good as fresh, and they don't have the added salt. And one of the easiest ways to reduce the need for added salt is by using spices, like dried or fresh herbs, basil, cilantro, chili peppers, roots like garlic and ginger, citrus like lemon or lime, and vinegar. They really add brightness to a dish without having added salt. Moving on to sugar, cutting back on the amount of sugar, honey, agave, that you're adding to things you eat or drink regularly, like cereal, pancakes, coffee, or tea. Cutting the usual amount you use by half and weaning down from there. Swapping the soda for water or seltzer is best. You can choose flavored ones or add things like fruit or cucumbers to your water. Comparing the food labels to the lowest amounts of added sugars. And when baking cookies, brownies, or cakes, you can often cut the sugar content by 1/3 or 1/2, and you often won't notice the difference. And you can learn to savor foods with less salt and sugar. Studies have found that we can shift our sense of taste to enjoy foods with lower levels of sugar and salt. And by making the changes gradually and consistently over a period of time, you may not notice it at all because our taste does change. Healthy eating can make a big difference in your lupus symptoms and overall health. Do your best to eat a diverse diet and try to consume all the major food groups. Focus on filling up your plate with fruits, vegetables, choose whole grains, lean proteins with an emphasis on fatty fish. Consuming a balanced diet may help reduce some of the effects of lupus, aid in reducing side effects of medications and treatments, maintain a healthy weight, and overall contribute to feeling better. About a year ago, I worked with the Lupus Research Alliance Young Leaders Board and Bristol Myers Squibb on a lupus community cookbook. Recipes were submitted by lupus patients and caregivers, and I provided some tips and tricks on how to reduce the salt and sugar in some recipes, as well as highlighting some ingredients that made them great recipes for people with lupus. So definitely check it out. The link is here. And thank you for your time.